was a patient who she had come down from a line-out drill. She was a rugby player and had fallen over, basically rolled her ankle significantly. She'd had an old rostrum repair of her ATFL several years ago, and she had a significant pain and weakness and some instability. So I saw her in the first 24 hours. Subsequently arranged for her to see a consultant and have an MR because of the concerns with the degree of laxity that she had with her ankle. So we tried the Geko in the initial phase of the injury, together with a couple of other treatments that we know have worked in the past when she's rolled her ankle. So a strapping that she's used successfully. She was partial weight bearing, and she used her price regime, which she's had before, and she found that within 48 hours of using the device continually, she had significantly less pain. The swelling had come down, although she still felt the ankle was unstable. She then went on to feel that her support from the lateral structures was also more comfortable, and that was, she came to see me on the Thursday, and that was over the weekend. That weekend subsequently she had her MR, and the consultant was concerned that there may be an avulsion fracture. She was immobilised. We continued to use the Geko with her post rehabilitation. That avulsion fracture was negated, but she had significant soft tissue injuries and bruising, and within 3 weeks of using the Geko and the post-operative, the rehabilitation process, she felt much more comfortable. Perineum was showing very good strength. The swelling had stayed down, and she has gone on to make a good recovery. She's now doing her active recovery. She's now 6 weeks post-injury and walking quite comfortably, but doing lots of proprioception and rehabilitation. So. We've also used it with an elderly lady who has a very long-standing osteoarthritic ankle, who has had deteriorating mobility over the last year. She has seen me for treatment with regards to swelling control, active exercise. We're in constant contact with her consultant, who would like to at some stage probably fix the ankle. She has seen me for swelling management, as I said, and has had some success with some taping strategies and some mobilisation to her rear foot. And within putting the device on her lower legs, she felt, as she walked from the clinic room, she actually reported that her ankle and her leg felt much warmer, which is great because she's had cold feet, as it were, for many years, and she volunteered this information instantaneously without any prompting. She has found that apart from having had this procedure by the consultant, that in fact the Geko has been helpful with her pain management and a little bit with the swelling to start with, but now much more with comfort, and she's able to get back to her part-time voluntary job, which she works in the city, although she has problems with pavements and so forth, which you'd expect with this ankle. We're looking at returning to a more active life.
Well, I cheated a little because I'd had it already put on by Pippa. So as I was a bit anxious about putting it on and getting it in the right place and where the top of the fibula was, not at all sure, I actually, with a biro, marked the previous one on my knee, so I made sure it went in the same place. So it was easy from that point of view. I forget it's there. I can feel it at the moment, I can feel it pulsing. But after a while, I suppose you get used to it. It's more comfortable and the ankle feels warmer, and that's a great asset too. Pippa suggested I gave it a go. Immediately this warm effect, well, the pulsation first and then the warming effect. And that was a tremendous comfort. And as a result, the pain doesn't seem as large, as intense. But the leg feels more comfortable. And certainly within that first 24 hours, my walking is easier. And I'm very affected by uneven pavements, so that is really an achievement for me.